So when we think about not just the raw sugar content or the high fructose sugar content, but the full food matrix and the level of work required to consume something. You mentioned, it's a big deal whether or not something has fiber versus no fiber. It's matters whether or not you have to like get something and then chew it versus just drink it. When it comes to things like beverages, like sodas, they not only
Yeah.
have high sugar content, but it's liquid, completely devoid of sugar. Are those types of things some of the worst offenders when it comes to sugar intake?
Oh, absolutely. There was a paper that came out of Harvard from Frank Yu's lab a few years ago that showed really for the first time that consumption of sugar sweetened beverages and also artificially sweetened beverages was directly linked to cardiovascular disease and increased mortality. And it was the drinks. It's, yes, consuming food certainly doesn't help that when it's high in sugar, but the drinking of these beverages really can be detrimental to our health. And there's a couple of reasons behind that. One, you can get a large amount of sugar in a small amount of time. You just have to swallow it. You don't have to, sit there and chew it. This is why I'm not a big fan of smoothies. Juices, I'm not a big fan of for obvious reasons because you're taking out all the fiber. You're just basically like, you know, keeping the sugar and you're getting rid of a lot of the good nutrients. But smoothies are, much, much easier to consume. And that's why I guess people are attracted to them, right? Because, yeah, I don't have time to, eat all this berries and vegetables in the morning. So I'm going to put it in a smoothie and I'll just drink it. That's great. But when you see people making a smoothie with, four bananas in it and, three apples and,
Yeah.
a
And
pint of
tequila
strawberry,
sometimes.
yeah, and tequila, it would take you, you wouldn't even be able to sit there and eat all that fruit. You
Right,
would
right.
be tired of it. So the thing about beverages is that they are almost like invisible calories.
Hmm.
Your body doesn't register the calories in a beverage. Like if you think about it, have you ever drank something like, a can of soda or beverage like that and been like, oh, I'm full? But if
Yeah.
you have equal number of calories in a solid food, you will be full.
Hmm.
So,
Hmm.
there's been lots of studies that have compared this and looked at, this difference that we experience when we consume something in liquid form versus solid form. It's
Yeah.
important.
Yeah, and I think this is again where I think with the analogy with drug addiction comes in, and what I mean here is that the form factor and the rate of absorption are very important for determining the reinforcing value that something has. So a classic example would be snorted powdered cocaine versus inhaled crack cocaine. They're
Mhm.
essentially both the same thing at the end of the day, but one of them is going to hit your bloodstream much more quickly and circulate
Right.
faster than the other.
Right, exactly. And when you're chewing food, you have to digest it. There's going to be a slow release of, these different components of the food as your body breaks it down, as your digestive system kicks it in and does what it does to, extract the nutrients from the food. Whereas that is really sped up when we talk about drinking something.
Mm-hmm.
And so the effects that you experience, when people have these sugar sweetened beverages are, very, very different than if they're going to be eating something that contains sugar. And that's part of the reason why, because of that route of administration.
Mm-hmm. How much do you know about the engineering of processed foods and how much conscious engineering goes into that?
Well, there's certainly a lot of consciousness that goes into it because it's a business and, people want to make sure that they're doing their research to make sure that whatever product they're developing is going to be successful. And I think that, people are, I guess, a bit naive if they think that the food companies care if the food is healthy or not. That's not their job, to be honest. I mean, their job is to make food and sell it. It's not like it says this is healthy food. They're not claiming it's healthy food. They never said it was. So, why should they have to abide by that rule?
Mm-hmm. Mm-hmm.
So I think that there is a lot that goes into it. Many food companies hire, food scientists that basically their job is to figure out how to make these foods more desirable, how to make them smell a certain way, how to even down to the packaging, like when you open the package, the sound that it makes. Because you have to keep in mind, this is all preconditioning. We come to associate that sound with the eventual taste of the food product. And after those pairings have been made a few times, we very quickly learn that that sound is associated with that delicious taste. So it's going to release dopamine just by having the sound. That's
Hmm.
why the advertisements and the way in which the packages are, kind of portrayed on a shelf, that's also important too, because it serves as a way to kind of prime us to then want to get that substance because we recall the taste.
Hmm.
So there's a lot that goes into it, even beyond what the actual food tastes like, to make these things desirable so that people will continue to buy them.
Hmm. If someone, has been consuming a lot of sugar for a long time and, they're effectively addicted to sugar, I would imagine there are adaptations, physiological adaptations that are going to distinguish them from other people. The level of sweetness receptors in the tongue is probably different, for example. If someone is trying to kick a sugar addiction or something like this, is this possible? How much time does it take? Does your tongue readapt? Can you sort of stop consuming sugars and then eventually come to enjoy the lesser amount of sweetness you get from eating a physical orange rather than a glass of Sunny Delight or something like that?
Oh yeah, absolutely. I mean, I wrote a lot about this in my book Sugarless that is out now. It's coming out in paperback in January. And, one of the things that I think people are intimidated by is this whole idea of, oh, I'll never be able to, find joy in food again, right? And I think this happens with people who struggle with alcoholism. A lot of times, one of the barriers for them giving up alcohol is that they've become so dependent on alcohol to just help them get through their day. And so they can't imagine life without it. And I think that's something that happens a lot of times when people are kind of struggling with sugar addiction is, I can't imagine being happy or satisfied or feeling good not having sugar. And physiologically, our body completely changes because when you wean yourself off of the processed food and the added sugar, what ends up happening is that, yes, your taste receptors are going to change. You're also going to see that the connections in your brain in terms of, the desires and the cravings are going to become easier and more manageable because it's again all about learning and learning theory. We're putting distance between the stimulus and the reinforcer. And if you're not providing the reinforcer, even when you get the stimulus, over time the learning is going to break down and you're not going to have those strong cravings like you had in the past. So that I think is important to keep in mind. It's just a matter of getting there. And people often will say, well, how long does it take? It really depends on the individual, like how much sugar they've been consuming, um, and also for how long. I mean, there's a lot of people who have been consuming lots of added sugar for a very long time. So it can take a while in cases like that. But what I really advocate is that people do not a cold turkey approach because I don't think that that really works. I know people typically, when we talk about addiction, think, oh, well, if someone's addicted to cocaine, you don't say, oh, just do a little less cocaine. You say, no, you got to stop doing all cocaine and just get off of it.
Hmm. But
But
the cocaine isn't in everything.
the cocaine isn't in everything. Yeah. And, there's like, it's pretty clear, like cocaine is cocaine. I know where I'm getting it. Um, but there's like shades of gray with lots of these different foods that are out there where maybe it's got a little sugar in it, but that's okay if I'm not having tons of sugar from other things that I'm eating. So I think it's important to do more of a stepwise approach and
Hmm.
focus on beverages. I think that should be the number one goal right off the bat, is to reduce the amount of sugar in beverages that people are consuming, and then kind of go from there and just work to reduce it and have less and less of it. And that again, it's going to have effects that are going to be positive for people's health no matter what, even by just reducing it little bits at
Hmm.
a time.